So I'll present on those this afternoon, and then of course leave time for questions and answers. The programs can be quite complex if you've never navigated them before, but of course I've been around these programs for a while, so I'll do my best to present them in a way that is easy to follow. So if you've attended the session earlier in the week, or if you've even heard anyone speak on seniors programs in the past, you've probably seen this slide about Alberta's aging population. And why it's significant to us in government is that it speaks to everything that we do when it comes to providing programs for seniors. When I started many years ago, the population of seniors in Alberta was relatively low. And we are, compared to other provinces, a young province. But that doesn't mean that the demographic isn't changing. It is changing significantly. And there are more seniors living in Alberta than ever before, and of course in the nation. So we are noting these trends and talking as civil service with our leaders in government to share with them what that demographic shift and change could mean. So, 650,000 seniors in the province of Alberta at this moment means that you have a large population that you could be planning for. What we're ultimately planning for is the million seniors we expect to live in our province in the next, within 15 years from now, so by 2034. So with that trend in mind, that's where we are asking government to make decisions about what kind of programs they'd like to offer. The programs that we currently offer for seniors, we put them under the umbrella of Seniors Financial Assistance because in 1994, the government of the day did move away from universal benefits. In other words, anybody who was a senior could receive a benefit toward a more targeted benefit programs. And the target is now based on income for the most part. And so when we talk about an umbrella of programs, we want to make them easy to access, and we put them all under one application, but there are several programs that are offered. So we'll talk about the 4 of them that we administer: Alberta Seniors Benefit, Supplementary Accommodation, Dental, Optical, and Special Needs Assistance. But I'd like to start right at the very beginning when you're talking about financial assistance. At age 65, in general, a senior would access the benefits available through the Government of Canada to get those primary sources of income that we as Canadians are assured that will happen at age 65. So these are the ones that most people are familiar with: old age security, the guaranteed income supplement, and the Canada Pension Plan if a person has contributed to the plan. So we again call these primary or core essential income sources for seniors. Old age security and Canada Pension, most seniors are aware of those and have paid into to the plan or are receiving an old age benefit. The one that might not be familiar to all is the Guaranteed Income Supplement, as it's an income tested program and it is again targeted to those with the lowest incomes. So we would want you to be aware of those programs initially when you're talking about assistance financially. However, you can then look to the province of Alberta to provide a range of programs and services that would help a senior either financially or through the health supports. And these are the ones that we are targeting to seniors through the following programs: our Alberta Seniors Benefit, Supplementary Accommodation Benefit, Special Needs Assistance, and the Dental and Optical Assistance for Seniors programs. Usually when I'm in a room of people, I usually do a scan of hands in the air as to how many people are familiar with at least one or some of these programs. And I am always surprised to find people who are not aware of them. But again, until you're 65 or approaching 65, most people may not be aware of these. So that's why I'm pleased to be invited today. In addition to our financial assistance programs, the Ministry of Seniors and Housing is also responsible for 2 programs that are intended to help senior homeowners remain in their homes longer. And right now, these 2 programs on offer are the Seniors Property Tax Deferral Program and the Seniors Home Adaptation and Repair Program, which I will be going into further detail on later in the presentation. Okay, so what we would like to now talk about is how to apply for Alberta Seniors Benefits. Generally, we want to make this process as seamless as possible for seniors, but there is a little work involved in turning 65, as anyone who's gone through the paperwork will know. In Alberta, what we've done is we've partnered with the Ministry of Health, who normally would have information about Albertans and their birthdays. We ask them to send an information package to seniors 6 months before their 65th birthday. And in that package will be information that they can review on all of the programs on offer and determine if they wish to apply. A single application is all that's required to enroll a new individual into these programs. So once you've done it once, even if you may feel you're not eligible at that time, we now have enough information from you to at least maintain a file and help enroll you at a later date if anything should change in your circumstances. So even though it is an optional application, I do recommend that people take advantage of the application when it comes to them and they apply at that point. Again, they may or may not be eligible, but it is a doorway into all of the programs. And if the programs were to change, then we could more easily and readily respond to the needs of the senior. One development that has happened as we've tried to again make the process more seamless is we've looked to the individuals who are already on government assistance programs, particularly the individuals who are on the Alberta Assured Income for the Severely Handicapped program. And we've done some work with our partners in another ministry to make sure that that transition happens without them having to apply. So it is an auto enrollment process for that group, and that is just recently that they've been able to take advantage of that. That was actually something that we implemented in July 2020. And it has, I think, been one of those things that people are really appreciative of because they know that government has some awareness of them from their time on the ACE program, and they appreciate not having to do a bunch of paperwork in order to just, turn 65 and start to get the seniors programs. Okay, so the first program that we would look at once we've received an application to see if the individual is eligible for assistance is our Alberta Seniors Benefit Program. This is the granddaddy of our programs. It's been around since 1994, and it was one of the programs that came into effect when several seniors programs were discontinued and we rolled them into one general program. I was working at the time of the implementation of this program, and there was a significant change, and the main being that we've moved to targeting assistance to low-income seniors to help them with monthly expenses they may have, and the intent there, of course, was to apply an income test. So as you can imagine, it was a lot of work to try and get all these individuals on the right program. Currently, there are about 26% of Alberta's seniors, of that 650 that we talked about, that are enrolled in this program and considered eligible based on their income. We, of course, want to enroll as many seniors as possible in the program. So we check income once a year through the Canada Revenue Agency. And if a person is filing their tax return, what we're looking to see is based on marital status, whether they fall within a certain threshold. The amounts you see here refer to line 15000 of the tax return. That's a total or gross income line. And although that line is not going to tell you exactly what benefit you're going to get, it does serve as a good benchmark for determining if you will be eligible or not. So a single senior with an income in 2019 less than $28,785 would normally be enrolled in our programs, whereas a couple would with combined income from line 15000 of $46,745 or less would be reviewed for eligibility. On the right side of the slide there, you're going to see a maximum benefit that is available. So again, knowing that we are intending to target to the lowest income seniors, be aware that that's the maximum amount. The benefits will range anywhere from $10 a month at the lowest, up to $285 for a senior that's single, and $428 for a couple. these maximums are available to the individuals with the very lowest income. So generally a senior who is only getting old age security and the guaranteed income supplement, if they have Canada pension, they would normally not receive the maximum benefit. Their benefit would be reduced for every dollar of income from other sources that they may have. So that then leads you to the other point on our slide there. So what's the average? So with the incomes of the seniors that are on our program right now, the average payment is about $144 a month. How do we determine eligibility? Well, this is one of our more complicated seniors programs, and there are several things we need to look at. So it's not just a case of telling us you're a senior and giving us access to your income, because there are 4 factors that determine the benefit we pay. We do need information as well about your marital status, and if it changes, we need updates on that. Your residence type, and if you're eligible for the old age security pension. At this time, individuals who are not receiving old age security would not receive a benefit from this program. Once they are approved, or if they have, or if they need to meet residency requirements before receiving that federal pension, they could still apply for some of our other health-related benefits, but they wouldn't be considered for this particular monthly assistance available to the low-income seniors. Okay, so what we do is we try and maintain the files for everyone who's on the program by asking them at least once a year to make sure that we have accurate information for them. So how we do that is when they are receiving a benefit, they receive a letter each July telling them that we've rolled over to a new benefit year and to please check their information, make sure it's up to date, and ensure they're receiving the correct benefit. So that does take a lot of work on our part because of how many files we're maintaining. And so we partnered with Alberta Supports to make sure that seniors can call in and give us updates and maintain their file throughout the year. I'll have more information on that service at the end of the presentation. Okay, so that is the main source of income for seniors with the low income, but we also need to look at a low income senior who perhaps is having health concerns that are going to require them to move into a higher level of care outside of their home. And when that happens, a low-income senior will start to incur monthly accommodation charges for designated supportive living or long-term care type residents. And because of that, they may not be able to meet their accommodation rates if they don't have pensions or income from sources that would equal what monthly rates are. What we've done is introduce the supplementary accommodation benefit to help those seniors. It is something that is combined with the Alberta Seniors Benefit on a monthly basis in order so that when they are placed, that they can start to pay those fees. What we want to do is also ensure that they have enough to pay the fees and have some money left over to pay for some of those incidental costs that a person will incur day to day, month to month. And so once we hear that an individual has been placed in a particular facility and we get that information from the facility directly, then we go back to their file with the seniors benefit and do a recalculation. What we're looking for here is, again, using total income to see if there's any shortfall every month. The income that they have from all income sources will be compared to the maximum monthly accommodation rate set by Alberta Health for a bed in one of those facilities. We will then add on a disposable income amount of $322. If the individual cannot meet their fees and still have $322 remaining, we will be topping up their income and helping them. The maximum benefit available here is $695 per month in addition to any seniors benefit. But it should be noted that this is also a scaled benefit according to income. So not everyone will receive the maximum. It will depend on where their individual income numbers fall and tell us what their shortfall is. So that's an important support for seniors, again, targeted to a low income. Okay, so I'll also move along now to one of Alberta's most interesting programs because it's really not comparable to what's available in any other province. We believe that we're quite unique in that most provinces are not offering the supports in these areas that we are. So what we do is we look at what is a special need? Well, a special need is something that we think is a low-income senior will find it difficult to save for or budget for, but these are basic and essential expenses that they're trying to meet. And so we are providing financial assistance to an eligible low-income senior toward the cost of some appliances and specific health and personal supports. We say some because with the budget that we have, we have to align our funding with as many eligible items as we can, but unfortunately we can't help with everything. So what we have done is identified supports that we see as essential and basic in nature. We have up to $5,100 available in a benefit year for that low-income senior, but most are not receiving the maximum because it is based on their actual need at that time and what they're asking for. So if an individual were to come in with some high costs, they may meet that budget, that maximum benefit amount, but we may also just be funding the amount of the actual expense that's causing them difficulty and that is eligible for consideration. We want them to be aware that our benefit year runs July 1st to June 30th. And so in that period, we do have maximums available and not just the 5105 yearly benefit maximum, but there are also some maximums for other items as well. So when I say what kind of items we should be helping with, well, we've broken down the expenses we assist with into two different categories. They're called primary and secondary expenses. Why we've done this is that really it's again to target the assistance to the very lowest income seniors who will receive assistance in either category. And then those with a slightly higher income would be eligible under the primary expenses. And these are ones that are common to a lot of seniors. Again, this program is based on income. And so we do require updated income information to consider any request for assistance. Common requests that we see from seniors who are trying to stay in their homes and deal with maybe changes in their circumstances with regards to health are prescription copays as those go up, even though seniors do receive assistance with their prescription medication costs from the Government of Alberta at 70% of their cost. There is still an out-of-pocket cost that is a copayment. And so as a person potentially has more prescriptions, they would have to pay higher co-payments maybe than they have in the past. We also see seniors who are having to supplement their nutritional needs through beverages such as Boost or Ensure. And even though those are items that people are really diligent about buying on sale, those can take a bite out of the budget if your doctor is prescribing high quantities of those per day. Of course, diabetic supplies, as we have seniors who are having to take on those costs as well. So the testing supplies that they need to do blood monitoring, glucose level monitoring. So those are things we also look at. Generally, a senior who is insulin dependent is already getting help with their diabetic supplies through the health department's coverage for seniors program, but that program is specific to insulin dependent. So in people who are maintaining their diabetes through diet and exercise or through medication, they weren't getting assistance and we're having to pay all those costs out of pocket. So we are one of the programs that can help as well. And then you'll note people who have the very lowest incomes and are living in their home may need supports in maintaining their home. That can be housekeeping, just general light housekeeping, or yard maintenance, which consists of snow removal or lawn cutting. So that's something this program considers as well. So who would be considered for this program? Well, again, low-income senior. If you look at this slide, you'll see a number that should be familiar to you. A single senior on seniors benefit at $28,785 or less would be eligible for a monthly assistance from that program, and also eligible to apply for this special needs assistance program. With respect to a couple, again, the same threshold that determines seniors benefit is the upper maximum here at $46,475. But I did want to draw your attention to that kind of lower income bracket where we're identifying the seniors who have low income who can apply for additional items under the program. So $24,385 or less and $38,545 or less when it comes to a couple. These thresholds are subject to change every July. And the reason we do that is that when a person is getting federal benefits, they normally will see cost of living increases added to those federal pensions. And generally they're small increases, but if we weren't adjusting these every year, in theory, you would start to see people being clawed back for money that was added to their federal benefits by making them less eligible for provincial benefits. So you're wondering why these numbers are kind of different, you know, they're not a set easy number to remember. There is a reason for that, and it's generally because we're adjusting to accommodate those cost of living increases and to target our funding to as many seniors as we can. Making a claim for our special needs assistance program is slightly different because, as I said at the beginning, usually one application will enroll an individual in all of Alberta's programs for seniors. But because this is a needs-based program where your expense dictates if you can apply or if you'll receive assistance, it isn't an auto-enrollment type situation where we can say, oh, they're low income, let's give them this money. No, what's happening is they're making a claim for a particular expense through this program once they've determined that they meet eligibility requirements for income. How do we do that? Well, we've tried to make that again as easy as possible for a senior. They have several options to do that, and the ones that we have been hearing a lot about is online options. So we've always had mail and fax options, but we now are offering the option to upload pictures or documents to a secure portal on our ministry website. No personal information is usually given at the time except for your healthcare number, but you can upload your document so that we can add it to your file through that portal. Another option that is secure and online is through a My Alberta Digital Identity account. And if anyone's been trying to access government services with Alberta in the last 2 years or 3 years, you've probably heard about these MADI accounts. And why we're using them is because they're a secure way for us to communicate and receive information. And it will be something we partner with Service Alberta to do more of in the future. But MADI is getting a little more awareness because it also links to health records. And if you're someone like me who wants to check your COVID test quickly, your results are right there on your health records, and you can go through that all through these secure portals. So a lot of interest from seniors about the efforts we're making to make a more digital way to access programs through the Alberta government. Also moving along to another health-based benefit, it's our dental and optical assistance program. So the Ministry of Seniors doesn't actually administer these programs, but we are partnering with health to make this available to seniors. And the reason being is that because it is income tested and intended to target assistance to low to moderate income seniors, we are the ones that have that income information. It doesn't make sense for health to collect it. So when they apply through our application process, we can, again, monitor eligibility for these benefits to help with basic dental and optical services. This information is then conveyed to the senior again as part of that annual review process. And new seniors who get assistance, or for seniors who may not be old age security eligible, they can come through these programs at this time without having to wait. So just think of these programs as something similar to what you may have had under prior dental and optical plans, where there is a basic coverage available But what is different is we don't charge a premium for this assistance. The fact that a person is low income is what's going to get them this coverage. If a person were finding that the coverage we have for the basic and essential items covered under the plan, if they're finding it's not sufficient for their needs, some of those seniors are seeking out supplemental plans through insurers, and they, of course, would have to pay a premium out of pocket for those. So the intent of this program is, again, to target the assistance to those who can least afford supplementary benefits, and to make sure that they get at least basic dental procedures and optical. This benefit is, of course, income tested, so we are looking at previous year's income, and we would refer the individual to line 15000 of the tax return to determine eligibility. These are the thresholds. So again, we say a low to moderate income senior is the target recipient of these benefits. So as a single senior, the threshold is slightly higher here at 31,675 or below. And for a couple, much higher than the other thresholds you've seen, 63,350 and below. You'll see that there's a range in the middle where you can get some coverage, but it's scaled according to your income. And then there is the maximum coverage where a senior gets the full amount covered for eligible services that's covered under the plan. Typical expenses here are, basic dental health, so x-rays, cleaning, cavity fillings, dentures. With respect to glasses, we are helping with new lenses and eyeglasses every 3 years. So again, date of service for this program is important to know when your renewal period will come up. And that's something we keep seniors advised of. So dental is once every 5-year renewal, and optical is once every 3-year renewal. We have more information about that in our publications and on our website, and I'll direct you to that as at the end of the presentation. And this is the slide I was just talking about, but I failed to advance, but here you go. So examination, scalings, fillings, dentures, root canals, extractions. The purchase of eyeglasses is $230 toward the cost of eyeglasses every 3 years. We recognize that that's much less than maybe what a person has to pay for glasses when they're purchasing new glasses, but it is intended to help with a portion of the cost. We do have some pretty frugal seniors who can find glasses for that rate. But again, just knowing going in that if you aren't able to find glasses at that amount, you would pay anything over and above the coverage available. If you use only a portion of the coverage, it'll still be there until you use it up or until your 3-year renewal period. Okay, so I see it's already 30 minutes past the hour, so I'll quickly go through our home equity loan programs, and then we'll be able to open it up for questions because there is a lot going on here. So home equity loan program. So some people may be familiar that government introduced some equity loans, I believe it was 2016 and earlier. And the intent of these programs is to help senior homeowners stay in their homes as long as possible, as long as they're able to do so, because that's what seniors tell us they would like to do. However, budgets and cost of living and they're in the fact that they may not have ways to supplement their income can make it more difficult. What we do know, though, is that there are seniors with equity in their homes that can secure loans from government using that equity to help them with repairs and adaptations to their home. So we've come up with the Seniors Home Adaptation and Repair Program. We refer to it as SHARP. It's one of our favorite acronyms because it's so easy to remember. But SHARP is there to help with any repair or adaptation that will help the senior stay in their home safely, be more mobile, perhaps improve their energy efficiency to bring their monthly costs down, and just for general maintenance to make sure that their home is retaining its value. We are targeting this assistance again to people 65 and older, so you do have to be over 65 to access the program, or at least one of you if you're a partnership. You can access this program after 3 months residency in the province, but we only help with your primary residence. So if you have other properties or maybe a summer property, this isn't applicable to that, just to where you live. You do have to have title, and so if there's more than one person on the title for the home, we do need all homeowners on the title to apply at this, and make sure that they're aware that there is a loan being requested against that title. We are looking at helping anyone with 25% equity in their home or more. So we're not convinced that it's a good bet to provide a loan to someone with less than 25% equity, but more than 25% equity, we can help with the repairs and adaptations. Keep in mind that our maximum loan is $75,000. So in all likelihood, if your equity is good, we won't be taking all of your equity, and that's not at all the intent, but you can apply up to that maximum. Most people are applying for some pretty obvious repairs that no one is getting assistance with, that they probably would have to secure some lending or a loan for anyway. And so we do it at simple interest with a low interest rate, and you do not have to repay the loan until you move from that residence. It's no longer your home. So from that perspective, it is slightly different than what you would get from any sort of financial institution. And we would normally are helping with these most common repairs: roof, window, some general renovation, furnace, flooring, bathrooms, siding, kitchen repair, decks. And I wanted to point out condo assessments. When there's a cash call for condos, we do get seniors in those properties looking at the loan program and using their equity to secure it. I have to tell you, the average loan is somewhere in the 13,000 to 14,000 range, and that usually is helping with most of these items. In addition to our home repair programs, there is another equity program, home equity loan program, that is intended to help a senior with their annual property taxes. And why this is important is that we know in Alberta and in particularly Edmonton and Calgary, we have some homes that have to pay some pretty steep annual property taxes. On a low income, that can be difficult to do. Sometimes seniors are making some tough choices about how they're going to pay their taxes and if they're going to be able to afford other needs. So one thing they can look at to do to free up income is to enter into this program where we pay their taxes for them every year. They secure the loan with us, and they do not have to repay until they sell their home. So it is available, this program, to all senior homeowners regardless of income, as long as they have 25% equity in their home, similar to all the requirements that we talked about for the SHARP program. This one just doesn't have the keen acronym. So it's an annual tax deferral program. So those are the programs I wanted to present to you today. There is a lot more to them, and so if you have questions, I will be answering those as best I can in the time allotted. But we also have a call center. You can call from 7:30 in the morning till 8 at night. Staff there are familiar with our programs, and they are able to access programs for seniors files. And it's a toll-free number here in Edmonton. We also have our website of just a plethora of information on there, as well as an online estimator, which could help you determine if you're receiving all the correct benefits, tell you what you could expect in the amounts of benefits. And then, of course, for people entering the loan programs, there's some interest calculators and things like that, always showing where we are with our current interest rate. Okay, so they tell me I should be able to now move on to seniors. Questions and answers by going to the chat area.
Yeah, absolutely. So if you're joining us by computer, if you just look at the bottom of your Zoom toolbar, you will see a little Q&A icon. We already actually have 3 questions typed out there. So Laura, if you click on that, you can see the questions. And if you would like to ask Laura a question, you can type your question there. If you're calling in right now, what I'll do is I will give you permission on your phone to be able to call in and ask a question. All you have to do that is press *6. So if you're calling in on using your phone, just press *6 if you would like to ask a question. Thanks, Laura.
Great. So I'm pleased to see some questions there already and some comments. So Leslie has indicated that it's amazing the number of seniors who do not need to know they have to apply for the core items. So one thing we're noting again is people who are really, governments are really interested in getting as many seniors on the programs as possible without them having to jump through a lot of hoops. In some regards, this means auto enrollment. So for example, when 11 months before a person turns 65, they normally get a letter from the Government of Canada saying, we know you're turning 65, we're going to automatically enroll you in the old age security pension unless you tell us otherwise. And so that does take some pressure off. If a person has consistently filed taxes and it's very clear that they're a Canadian resident, then it's really easy. For us though, because we're a supplement to those federal programs and essentially a social assistance payment, it is optional and not all seniors may want to apply for our program. So for that reason, we give them the option of applying at 65. Certainly they can apply at any point thereafter, but it is an easy way for us to maintain a record of the seniors in Alberta who may be eligible for benefits. I think you can see though from the programs that not every senior will be eligible based on their income. There is also a comment about the helpfulness of enrolling AISH recipients into the seniors benefit at age 65 without having them doing any additional paperwork. The question is, are they also auto-enrolled into the Blue Cross Coverage for Seniors program group 66? And yes, that is part of what we are doing to help seniors access all of Alberta's programs at age 65. So for them, we are validating everything we can behind the scenes, making sure that information is shared with Alberta Health through a digital process, which usually happens every evening. And for that reason, then the department is able to issue them their new coverage card the month they turn 65. So a lot of the work we do is leading up to age 65. So again, that 6 months before turning 65 gives us the time we need to collect information and determine eligibility the month before a person turns 65, so that when they do turn 65, the health department can then action what they need to for the group 66. We have another question here from an attendee who's asking, if a person has entered Canada and Alberta just before a few months as a permanent resident at age 65, are they eligible to apply? Yes, the individual who comes to Alberta or to Canada, once they have been in Alberta 3 months and have a valid personal health number through the health department, may apply through our seniors financial assistance application for Alberta's programs for seniors. I can tell you that a person who's a permanent resident over 65, after 3 months, they may potentially access the dental and optical program, our special needs assistance program if there is an applicable expense there, and of course the coverage for seniors for their prescription costs. They will not be considered for the monthly payment. Is paid to a low-income senior who has been here and is receiving old age security. So I think that's the nuance you're looking for there. I hope that answers your question.
And actually, Laura, we have a phone, a caller who would like to ask a question over the phone. So caller, please go ahead and ask your question.
Yes, you've had a good session here this afternoon. I think you might have answered it in your later comments just now, because earlier when you were talking about dental and optical assistance, but you didn't mention anything about hearing aids, but here at the end you did say there was something like with Blue Cross, so I think that answers my question there. Thank you.
There's some supplemental information I'd like to give you on that. So as it stands in Alberta right now, hearing aid assistance is provided through what's called the Alberta Aids to Daily Living Program. That program is administered through the Health Ministry, not the Seniors Ministry. But what we've done to try and facilitate people who need hearing aids in getting the assistance they need is when they go to a hearing aid provider, the provider will normally tell them that they only have assistance with one hearing aid and that assistance is a set amount. So in other words, most people are going to get their set assistance amount and then have a copay that they'll have to pay for one hearing aid. Alberta has determined that if you're a low-income senior and you need 2 hearing aids, what the Alberta Aids to Daily Living Program will do is provide supplemental coverage for a second hearing aid at a rate that is determined based on the fact that you are low income. And so for our ministry, what we do is, because we are aware of who the low income seniors are, we do have an ability for the vendors to just do a quick check by healthcare number to say, is this a low income senior, yes or no? And if they get a yes response back by checking the healthcare number, then that means they can submit additional claim for a second hearing aid. So there is a little more nuance to that question than you thought. So I'm really pleased you asked.
Yeah. Okay. Thank you very much.
Okay, there's a couple more questions here on the chat that I'd like to get to. And Brian has asked about, my wife is in long-term care and they are involuntarily separated because of that, with one in care, one in the community. Why am I classified as married? So this is a question that can be treated differently if you're talking about federal benefits or provincial benefits, but the concept is the same. One person has gone into care based on a health need, through no fault of their own. They've been assessed as needing a higher level of care than can be provided in the home or community through home care. And so that involuntary separation is what the federal government first looks at to see if they can provide additional benefits to that household. And so once the paperwork has been put into the federal government, they look at each individual in that couple to see if there's benefits available to them. Alberta takes a slightly different position, and we say that, yes, even though that involuntary separation has happened, we still look at you as a couple, but we average your income, we split it in half, so 50-50. And then we look at your eligibility as a couple under single senior thresholds. So I think what I'd like you to take away as part of my answer to your question is that once you're a couple, you're always considered a couple here unless there's a true marital breakdown, in other words, separation or divorce. But when you're still a partnership, a couple, and you're separated due to health reasons, we are going to try and maximize your benefits by providing you with additional assistance under our programs, but it will still be targeted based on income. And so the definition or how we classify your income is different than what they do at the federal government. So we just want people to be aware of that. There is paperwork involved in it from the federal perspective. From our perspective, we just need to know once placement occurs, and that usually happens in partnership with the facilities. They give us the information we need. As long as our application is up to date and in good standing for that couple, we can then proceed with a total recalculation. It may not result in benefits for every couple because, again, the income test that we apply, but certainly it is a way for us to maximize benefits, either under the seniors benefit or the supplementary accommodation benefit. So I hope that helps with that. It is a big part of my job. I talk to a lot of couples going through that and families going through that. It can be very complicated, and social work teams are a great help, but there is a time sometimes when they're not sure where to go next. I usually recommend going to our website and looking at that online estimator so that you can just pull out your last year's tax return, put in the numbers, see how you would be considered once we recognize that you're in 2 separate living accommodations. One more question I'd like to get to before our session ends, and it's, I have a friend turning 67. She worked during her life, but has not filed tax returns for about 20 years. Is there help for her? This individual should be encouraged to do a tax return, obviously, because we want the federal government to be able to provide her with all of federal assistance that might be available to her. However, as long as she's getting old age security and does an income declaration with our ministry, and that's something she can pull off our website and she can fill in with copies of her T-slips. She would be able to access our programs even though there is no tax return filed. We do say though that after a year being on our program on an income declaration, it's going to be more seamless for them if they continue to file a tax return every year, because then we can auto enroll them every year, update their benefit, just send them a letter saying here's what you can expect for the next 12 months. So to get her started, absolutely she can access the benefit, but she will have to do an extra form with her application, and she should send us copies of her tax return, T-slips, with the slips that are sent every February. Otherwise, she'll have to go to Canada Revenue and get a summary of her T-slips so we can validate that information.
Amazing. Thank you so much for this, Laura. This has been an incredibly wealth of information that you've shared with us. I want to thank you so much for doing this and doing this on a Saturday. I really, really appreciate that. I know that's it's a big ask, and I appreciate you being here with us. I want to also thank all of our attendees for joining us as well.